evening guys. Today we are going to discuss important topic about ACL injury and its management. So ACL is the most common knee cruciate ligament which helps us to prevent the knee from rotating anteriorly, translating anteriorly and rotating externally. So ACL is called as the anterior cruciate ligament, which is a primary stabilizer of your knee. So let's discuss about, we are going to discuss about how does ACL injury occur, its types, how can we prevent it, and how can we manage it if an ACL injury occurs. So let's first discuss about how does ACL injury occurs. ACL injury usually occurs due to hyperextension of the knee, that is while playing cricket, while playing soccer, while playing any other games, or while doing hyperextension activities of knees like running, jogging and jumping. So patients usually complain about a clicking sound that is heard when they hyperextend their knee. Usually in this kind of injury, patient has a pain in their knee, patient complains of swelling of the knee, and sometimes patient is unable to extend or flex his or her knee. This is because of an injury to your meniscus. So now let's discuss about how to prevent these injuries. So we can prevent the ACL injuries by various ways, like we can take care that our knee is not hyperextended, but in situations like when we are running or in situations like when we are playing football, no one hardly pays an attention that our leg goes into a hyperextension or something. So we should prevent our injuries by wearing knee caps while playing such games like soccer, or while playing cricket, or while running, jogging and jumping, so that we prevent ourselves from a hyperextension injury. Now let's discuss about what happens when patients land up with an ACL injury. So usually when patients land up with an ACL injury, patients do complain of pain, swelling in the knee, inability to walk properly. Patients give a persistent symptoms of instability while putting a weight on that knee. Now let's discuss about how do we identify that a patient has an ACL injury. So there are various methods by clinical examinations by which we identify how do we know that the patient has a clinically ACL injury, like few tests like Slatchman stress, drawer test, and various other clinical examinations through which we can quantify whether a patient has a complete ACL tear or whether the ACL tear is a partial one. We also would like to get few diagnostic examinations like X-rays and MRIs. X-rays are here to diagnose whether the patient has any bony injury or whether any soft tissue injury, if any. Then we do a MRI. In MRI, we know how much is the ACL tone, whether the ACL is toned completely or whether few fibers of the ACL are toned, so that we can decide whether we can conserve the patient and rehabilitate the patient so that he can get back to his sporting activities as soon as possible, or whether we need to do a ACL reconstruction. In cases of ACL reconstruction, there are chances that the patient has a medial meniscus tear too. So we have to look in MRI for a medial meniscus tear also. But primarily while doing an ACL reconstruction, I'll show you a video which demonstrates very nicely how do we do an ACL reconstruction. So in this we can see that there is a left knee which points out towards an ACL, anterior cruciate ligament. Then in this video we will demonstrate, in this animation we will demonstrate how do we reconstruct an ACL ligament. So we take small incisions, we take a guide wire through which we drill in our femur so that we get an appropriate tunnel length for our hamstring graft, which is going to go in, and that's a tunnel through which we bring out our graft. That's a tunnel which we have drilled in the femur right now. As we go ahead, we can see we will drill another tunnel that is going to be through tibia. Now we are passing a loop, and we are passing another cannula so that we take out that loop through which we will pass our graft in. And there is another tunnel which has come out which again passes a loop so that we can pass our graft in there. So this is an all inside technique of ACL reconstruction. So now we pass the graft towards the femoral end first, and then we flip a endo button, which you guys can see here. There is a button out there. Then we try and flip the graft through the another loop into the tibial end, and we try to fix it with an interference screw so that it does not move, or with an endo button, as you can see here that we have placed down there, so that the graft does not move from its position and it heals in the same position and acts like an anterior cruciate ligament. We take a hamstring graft from the patient by a small incision and drill 2 tunnels, one at the femoral end and one at the tibial end, which is being fixed by a button at the end of the femur and a screw at the end of the tibia, which usually dissolves in the patients within 2 years of their lifespan. So this ACL reconstruction is a surgery which we usually promote in cases only if the patient has a complete ACL tear. If a patient has a partial ACL tear, we ask the patients to rehabilitate with the help of a physio so that they can get back to their sporting activities at the end of 6 months at least. But if the patient has a complete ACL tear, we reconstruct the ACL completely arthroscopically, that is through a keyhole surgery, so that the patient can get back to its sporting activities within at least 9 to 12 months of the surgery. Thank you so much for listening me, and do let me know in comments if any issues with your ACL. We'll be happy to get back to you on your needs. Thank you.